Good afternoon, everyone. Dr. Sarvar and Jane from Personalized Physical Therapy and Wellness and Dr. Jane Bowser. We both are back again with the COVID-19 health series, and this time we're talking about squats. And the reason why we're doing that, obviously, hopefully soon we'll have the gym start again, and we might be very close to starting to our workouts and do our squat form. And so, Jane, would you mind telling us why the squats are so important in our leg series?
Sure. So when you think about a squat, you're thinking about the foundation of your body and your stability and your balance. And so when people tend to get weak leg muscles, they're more likely to stumble, fall, and sometimes a fall, if you're older, can lead to a broken hip, and then that can just be the beginning of the end.
That's true. That's true. And so you have actually helped your dad with some of the squat form.
Yes. So my father is 92 years old, and he was starting to notice a lot of leg pain, a lot of balance issues, and so we started working with him on squats. And the way we started him with squats was with the chair. And so what I said is, Dad, you just need to be able to sit in the chair and get up. All right? So when he started, he was sitting in a chair like this and then getting up. And he would do like 10 times a day. He could do that. And then as he progressed on, eventually, now he can sit in the chair and get up. He doesn't have to use his arms. And so his balance is better. And then now he's actually moved to the ottoman where there's nothing there, and he can actually get down on that and get back up. And he can even get down on the ground and get back up, but he's still working on that.
Awesome, awesome. And so let's go over some of the ways that the people might end up doing it, the squats, which are not the best for the knees, and so how you can protect your knees when you're doing the squats and when you're building your leg strength. So we're going to turn the chair this way, and Jane, if you don't mind coming right in front of the chair.
Okay.
So not so best way to do a squat is obviously kind of lean that knee forward and kind of go in. So what you're seeing, if you can hold that position, Jane, is that the knee is falling past the toe, and then your hips are also not far back enough where the glutes can fire, and then your trunk is facing down where then your head can start having irritation or your mid-back can start having pain. And so the way we can correct that is individually, make sure that you want to have your hips far back. So Jane, if you don't mind going for a squat where you bring the hips back far enough, excellent. And stay in that position, hover, and bring the chest up a little. Excellent. Hold that. So what you notice is that the toe and the knee is in line. When you're looking from the top, if you can look at your toes, Jane, you should be able to see your toes from that angle. And then at the same time, having the chair or having some form of a visual that you're reaching for is very helpful, because then you know that this is where you're aiming for. You're not really sitting, but you're aiming for that, thinking about you're sitting in a chair, and then you decide not to when you come back up. So that's a perfect way to do a squat. Make sure when you are doing the squats, you don't have any knee pain. You are feeling the burn more in the quads, the glutes, and then you're maintaining a very upright position for the squats. But Jane, you also mentioned about the brain health and the connection with the legs.
Sure.
Do you mind sharing that?
Yeah, so there's been a lot of research that shows that the one correlation of the strongest muscle that connects to your brain health is with your legs. And so doing squats is not only helping your body and your balance, but it's also helping your brain.
Wow, that's a fascinating study, and I would like everybody to watch this and do the squats very in a correct manner. But we'll be back next week with another one of these exercises in our leg series with the COVID-19. But till then, stay safe, stay healthy. Bye.
Bye.